My name's Sovik Paul. I'm the CEO and founder of CathBuddy, where we're reducing urinary tract infections with our patented, reusable, no-touch catheter system. My introduction to the world of catheters happened in 2014 when my good friend Karina sustained a spinal cord injury in a car accident. Ever since, like 1.1 million other North Americans with neurogenic bladder, she uses 4 to 6 urinary catheters a day in order to urinate and suffers from frequent, complicated urinary tract infections. The problem is that catheter users today really only have 2 options for catheters. Straight catheters are the standard of care, but associated with a 50% UTI incidence every year. No-touch or closed system catheters reduce this incidence to just 20%, but are so expensive that they account for less than 10% of all Medicare-covered catheters, and every product on the market today is labeled as single-use only. We're developing a reusable catheter system that's both no-touch and affordable. Our catheter and insertion aid are reusable up to 100 times. They provide the feature set and UTI reduction benefit of no-touch catheters. They improve the ergonomics of catheterization through our proprietary designs, and the product lifetime has been validated through research conducted with the Cornell Center for Materials Research. Our patented at-home sterilizer can allow a user to sterilize a day's supply of catheters and insertion aids simultaneously. It utilizes RFID to track catheter use over time, and it features a small footprint so that it's suitable for the home environment. We can offer this system at a fraction of the cost of the current single-use solutions. An annual supply under Medicare coverage of straight catheters is $4,500 a year. Closed catheter systems are closer to $19,000 a year, and we can provide that same functionality at a price point of just $2,400 a year if we charge $100 per catheter and insertion aid. Even at this lower price point, we reach a $2.6 billion annual serviceable addressable market, meaning that this is a multi-billion-dollar market opportunity in an industry that's otherwise been stagnant and hasn't seen meaningful innovation over the last 40 years. We're developing our strategies to go to market and commercialize the device by directly engaging with stakeholders. We've submitted a pre-submission to the FDA. We are a Class 2 de novo device. We have to show lab bench and human factors testing data to get approved. We've been speaking to Medicare contractors, and we have to demonstrate non-inferiority relative to the existing standard of care to get a new code implemented. And remember, the existing standard of care is associated with a 50% annual UTI risk. As a basis for our clinical studies, we've been looking at existing literature, which has been able to show statistically significant UTI reduction using small study populations, including studies that are as small as 27 participants. So we think that demonstrating non-inferiority is an achievable goal. We have a well-qualified executive team. Prior to starting CathBuddy, I was a design strategist at Johnson & Johnson with a focus on consumer medical devices. Our chief medical advisor is Dr. Daniel Wallen, who's a practicing urologist at the Brigham and Women's Hospital in Boston and a member of the clinical faculty at Harvard Medical School. We've been engaging with expert remote collaborators in a hub-and-spoke model. Our product development team includes an individual with over 30 years of experience in medical device reprocessing. We have an extensive strategic advisory board. I'm thankful to say that my friend Karina, who is the inspiration for this company, is one of our customer voice advisors. We've made a lot of progress on a shoestring budget, and we're currently raising $500,000 on a convertible note. We've raised $200K of that round with $300K of space remaining. We're using the remaining funds to develop a functional prototype to gather data for a Class 2 de novo submission. We've had some success in raising non-dilutive funding to date, including a generous $35,000 US grant from the Praxis Spinal Cord Institute. We're disrupting an industry that hasn't meaningfully changed over the last 40 years. A reusable system makes a lot of sense. It allows us to prevent avoidable UTIs and save insurers hundreds of millions of dollars a year to boot. Thank you.